Hi, I'm Arthur Kaplan. I'm at the NYU School of Medicine, where I run the Division of Medical Ethics. Recent article by scholars at the Hastings Center, a bioethics think tank up in Garrison, New York, north of New York City, made an interesting point. And they said they didn't think that patients should be viewed as consumers. I really agree with that argument, and I also would argue that doctors should not be viewed or referred to as providers. What's happening in our healthcare system is more and more the language of business is shaping and changing descriptions of what doctor-patient encounters are all about. The Hastings people said talking about patients as consumers implies choice and activity that patients and would-be patients don't engage in. For example, if I'm a consumer, well, I might be buying beer, I might be trying to figure out where to go on vacation or what hotel to stay in, and I can search websites and get information on products. I can certainly price shop a little bit if I choose to and see who's got the best deal. A patient or would-be patient often has no choice. They're in a system. They're told you've got to go to this hospital or this clinic or this practice. You don't have any choice about what you're going to do. If you're beset by a sudden health problem, you don't have time to go shopping to see what orthopedist or diabetologist you want to see. You might quickly get some recommendations from people you know or maybe your primary care doctor, but you're not going to act like a consumer. Consumer behavior is not characteristic of our healthcare system because, in all honesty, our healthcare system is not really a market-driven business. It doesn't have the information. The patients are not in the position to do the shopping or the research that would lead them to act like it was a market. I think they're much more vulnerable. I think they're much more dependent, and they're much more, if you will, in the dark frequently, and often they have no choice. The emergency room you wind up in is not something you shopped about online. So I really think we ought to stop talking about our patients as consumers. I think doctors should be referred to as physicians, not as providers or other business descriptions. I know everybody's very excited these days about bringing in practice from industries like the hotel industry, where we try to get patient satisfaction by having better meals or nicer sheets. I'm worried about that trend as well, because I don't think hospitals should become hotels. They should become places where infections are low, treatment is efficient, and people are comfortable given what we have to do there. I'm a little bothered about that kind of marketing push as well. So overall, I don't want to replace medical ethics and medical professionalism with business jargon and business ethics. I don't think that serves patients well. I think it starts to have implications for how to operate the system that are not good for physicians, that start to make them feel more like pawns or just agents without professional standing, without respect and authority that goes to being a profession. I know medicine has to involve money. I'm not naive about that. But it doesn't mean that we have to invoke a business framework when we're trying to make decisions about how best to serve patients. I'm Art Kaplan. I'm at NYU Medical School. Thank you for watching.